My name is Jonathan Alvarado, and I'm the second negative this side. And I'm going to be answering some of what both the affirmative side was arguing, and then at the end we'll be putting in some of the workability arguments that I have against legalizing euthanasia or physician-assisted suicide. And so, answering to John's speech, it says, or he said earlier that there's no evidence basing off that physician-assisted suicide would lead or evolve or even grow into other non-voluntary physician-assisted suicide or euthanasia. And his example was from the Netherlands, and so I have an example, a counterexample, same place from the Netherlands, from care.org and care.org. In one of their reports, and it says almost 1/3 of the cases in Netherlands are called non-voluntary euthanasia because a patient's request was not explicitly stated. With all these examples of doctors abusing their powers, there is a trend showing that some doctors, regardless of location, will do the same. As a statistic going on from the 1990s saying that in the Netherlands in 1990, about 1,000 patients were killed without their request. And percentage-wise, like he mentioned, it might not be a lot, but 1,000 people without explicitly saying that they wanted the euthanasia were killed, that's still a significant number. Adding on to the fact that doctors will misuse and abuse their powers, I do have other examples for that, saying that on one of the reports in the United States system, it says that the do not resuscitate order, which is saying that if something were to happen in case of like a heart attack or anything like that, the doctors are not allowed or will be able to refrain themselves from helping the person and just let them die of natural causes. The do not resuscitate orders are more commonly used for older people, and in the United States for Black people, alcohol misusers, and non-English speakers, and people infected with HIV. This suggests that doctors do have stereotypes when they're given the ability to take the life of somebody else in their hands. Going on to a second point, it says patients do suffer. There are examples in the palliative care that counteract that. For instance, when you choose palliative care, you are assigned a palliative care team. And from getpalliativecare.org, it says, your palliative care team will identify your sources of pain and discomfort. These may include problems with breathing, fatigue, depression, insomnia, or bowel or bladder. Then the team will provide treatments that can offer relief. These might include medication, but along with massage therapy and relaxation techniques. So it's not only just the medication that's going to help these people out, but there are also other methods that will help them stop their suffering. Another thing that a lot of for the suffering part was that a lot of people see palliative care as their significant other or their family members suffering, with tubes attached to them and different things like that. But hospice care is different. According to the carelibrary.com, it says it makes sure that someone is relatively free of pain, is often able to be awake so they can remain active for part of their families, until a few hours or even days before their death. They do not use monitors or tubes and tries to give as much control to the patient and the family as they choose to have. And the last one is the doctor-patient relationship. There was, Nesser did say something about that it's being allowed in 2 states now, and the other 8 states are trying to get it there. So that's of recently, people are starting to get that, but for the last 2,000 years, even starting with the Hippocratic Oath, it did state that euthanasia was not something that you wanted to do. According to rsrevision.com, if euthanasia was legalized, the relationship of the trust between doctor and patients is destroyed by breaking that oath. Also, by giving the doctors the ability to perform the euthanasia, it's giving them the right to kill. According to CQB, the decriminalizing of euthanasia and assisted suicide depends entirely on the participation of medical profession. Ultimately, it is the doctors who are asked to decide whether it makes more sense to preserve a life or end it. Physicians find themselves put in the position of arbitrator. The result is a loss of patient's autonomy and a corresponding increase in the power of the medical profession over the individuals in its charge. So some of the workability issues that I have on this, aside from everything, so workability is why this law wouldn't work at the end. And one of the things against this one is that the definition for terminal illness is not well defined. Terminal, at least in the doctor's point of view, with people advocating for euthanasia, means the death is expected in 6 months or less. But according to NCBI, another online website that records, and in this case, put 20 doctors, 20 nurses, and 20 medical students through 70 hypothetical patient scenarios. They found that, respectively, doctors, nurses, and students missed the life expectancy date by, so doctors of 1.46 years, so almost a year and a half, nurses by 1.8 years, and students by 2.24 years. In total, the life expectancy predictions were the same in less than 10% of those scenarios, and were accurate within 25%, only 45% of the time. So they were only about a fourth accurate in less than half. So the 6 month time date that they're given before actually isn't as accurate as it may seem at first. Other ones, the euthanasia is defined as a final decision to end someone's life, and there are examples. One from amednews.com saying that a person, David Pruitt, a lung cancer patient, awakened 65 hours after the dose prescribed to kill him, saying that euthanasia does not work in all cases.
I got to cut you off because you're way over time.
Okay, this is my last one. That's fine.